Meet Uta Lawrence, author, former magazine publisher, and survivor. In September 1999, Uta and her husband Stan had set out from London to Windsor.
But then all of a sudden here was this wall of fog. And as we entered, Stan had to put on the brakes almost immediately. But then all of a sudden all hell broke loose when an 18-wheeler went over our trunk, and the crashing of metal and cars. There were 87 cars, and we were kind of in the middle. The most horrifying thing was when everything went still and I looked around and we were trapped in our car. And, you know, I thought, now we're going to burn to death. It was just absolutely horrifying.
Uta and her husband practically walked away. On the outside, nothing appeared to be wrong. But inside, Uta was tormented.
Eventually, I was totally out of control, going from hyperarousal to numbness and to and fro, and it was just exhausting. So I realized that I needed professional help.
At London Health Sciences Centre, Uta was diagnosed with acute post-traumatic stress disorder and referred to Dr. Ruth Lanius. Dr. Lanius and her team are using neuroimaging to better understand PTSD.
What we're doing here is really looking at brain activation before and after treatment, and this will help us gain a lot of insights into what are the key brain areas involved in perpetuating the disorder and what brain areas we need to focus on in the treatment of this disorder.
Not only is research going to enable better patient care, but at the same time, it is addressing a wider social issue, the stigma of mental illness.
And so what I think neuroimaging can do is change an invisible injury to a visible injury. And I think that can really help with stigma. If you can show people, you know, there's actually something wrong in the brains of people with mental illness.
Uta continues to work through her memories of that fateful day 10 years ago. With care at London Health Sciences Centre, she's well on her way. She's written a book and founded an association to help others.
The compassion and the care I got through the trauma center was exponential.